Good morning, and I have a story out of Colorado, and I think this affects the whole world on how they're ruling deaths. It's now been proven that they're marking deaths that has nothing to do with coronavirus as someone dying of coronavirus. A Colorado man died of alcohol poisoning, but his death was blamed on coronavirus, which is bullshit. The person who changed it to coronavirus should be fined a couple $1 million and have their medical license yanked. Now on to the story. A Colorado man who died of alcohol poisoning had his death classified as due to coronavirus, possibly shedding a light on the skewed virus death totals, according to a report Thursday. Sebastian Yellow, 35, was found dead by police on May 4th. Montezuma County Coroner George Dives later determined his death was due to acute alcohol poisoning. His blood alcohol content measured at 0.55. So, damn. That how the fuck did you drink that much and stay conscious to get that drunk? The legal limit in the state is 0.08. But before Davis signed the death certificate, Colorado health official reported Colorado's Yellow's death as being due to coronavirus. Yeah. From Brian Massey's at Brian CBS 4, what killed Sebastian Yellow? Coroner says he drank himself to death with 0.550 blood alcohol reading. Ethanol toxicity reads death certificate, but at CPDHE has categorized it as COVID-19 death, raising many questions. At CBS Denver report and gives a link to go to their thing. There should have been a recording that some way I do. They have to go off the truth and facts unless there is such. There is according to Denver KCNC TV. Back in April, health officials in Colorado classified 3 nursing home facilities as COVID-19 deaths, even though attending physicians ruled they were not related to the virus. While Yellow later tested for COVID-19, Davis said the death had nothing to do with the virus. It wasn't COVID-19, it was alcohol toxicity, said Davis, according to the station. Yes, he did have COVID, but that has not took his life. No, they just want anything so they can pad the numbers and justify the lockdown. They just being they just want to keep a string of hold on the nation. The Colorado Department of Public Health and Environmental released a statement to CKCNC TV on how they classify COVID-19 related deaths. We classify a death as confirmed when there is a case who had a positive SARS-CoV-2 COVID-19 laboratory test and they died. We also classify some deaths as probable. The statement states. So someone gets shot in the head, but they have the virus. They died of that. Good. The guess is there must be a strong epidemiological evidence of COVID-19, such as a combination of close contact with a confirmed case or symptoms of COVID-19. We will also count deaths of COVID-19 where there is no known positive laboratory test, but the death certificates list COVID-19 as the cause of death. Dr. Deborah Briggs, the response coordinator for the White House COVID task force, said in April the federal government was classifying the deaths of patients infected with coronavirus as COVID-19, regardless of any underlying health issues that could have contributed to the loss of someone's life. Again, get shot in the head, you have the virus, you died of the virus, not being shot in the head. There are other countries that if you had a pre-existing condition and let's say the virus caused you to go to the ICU. And then you have a heart or kidney problem, she said, during some countries are recording that as heart issues, kidney issues, but not as COVID-19. That's how it should be. What actually kills you? Classifications, instances like that of yellow could mean that the virus is overcounted, although some doctors and officials believe in the reality is opposite due to other reasons. During Dr. Fauci's testimony before the Senate on Tuesday, he said undercounting could result from people who died at their homes from the virus but weren't counted or tested because they never reached the hospital. I think you are correct that the numbers is likely higher, Fauci said in response to a question from Vermont Senator Bernie Sanders, according to the Washington Post. I don't know exactly what percent higher, but it's certainly higher. Fauci wouldn't speculate if the numbers were 50% higher than the current U.S. death toll, however, he said. Most of us feel the number of deaths are likely higher than that number. There are more than 1.4 million confirmed cases in the U.S., while at least 85,000 people have died from the virus as of Friday morning, according to data from Johns Hopkins. No, you guys prove that you guys are not counting it right. Anyone who dies of anything is now being counted. This is bullshit. People who do that should not be allowed to practice medicine. Why don't you let me know what you think? And comment down below. And as always, click the like button and subscribe, please. It will really help me out. And always be safe, be good, have fun. Bye bye.